Hi everybody, I'm Dr. Harshana, Medical Head, Ageless Clinic. We as Indians tend to get pigmentation. So today's talk, I'm going to talk to you all about pigmentation. What can we do about the pigmentation in terms of treatments and what you can do at home to prevent pigmentation and help prolong your treatment after you've had it done. I'm going to try not to sound very technical, but I'm going to try to cover broadly what all you have out there, anywhere in the world, for pigmentation. I'm going to talk about lasers, I'm going to talk about peels, I'm going to talk about mesotherapy, I'm going to talk about IV infusions, and lastly about super Medi-Facials. Under lasers, for lightening of pigmentation, we have the Q-switched laser and the Pico wave laser and Picosure Laser. And then you have IPLs, which are not actually lasers, they're more light, but these are three main things that you have in the market for pigmentation. My favorite is the Picosure Laser. It works beautifully on the most stubborn pigmentation, and you usually see results within the first to second session. Under peels, because there are so many types, you should actually do one based on your skin and based on what you're expecting out of the peel. So let me give you an example. Let's say I have a client-facing job and I have a little bit of pigmentation and I don't have time for a downtime. I'm going to choose a peel which is a little bit more superficial and something that allows me to go to work the next day. You must note in these situations, you may need more sessions of the same thing, and don't compare yourself to somebody else who sat at home for 5 days and allowed the peeling process to happen. So what I mean is, we have superficial peels. So if this is my skin, a superficial peel works on this layer of the skin. So certain examples would be glycolic acid, salicylic acid, lactic acid. So these work very superficially. You have peels that work on the deeper layer of the skin. These usually tend to have a little bit more of a downtime. So examples would be TCA, Cosmelan. So these work on the deeper layer. So that's peels for you. So like I said, just a reminder again, make sure you choose a peel based on your downtime. Next, we spoke about mesotherapy. Now, what is mesotherapy? Meso means small. Therapy is therapy. So mesotherapy is using small amounts of whatever I'm using to cause lightening of my pigmentation. So I put it as micro droplets into the skin. Now, how I put it varies. I can use a gun, I can use a meso jet, I can use tiny micro dosing bottles, which are my favorite, and I can actually inject it. So that's mesotherapy. And in that, what is it that I use? I can use vitamin C, I can use idabinone, I can use any sort of serum that helps brighten the skin, and you actually get serums that help in mesotherapy. A lot of craze now is using mesotherapy at home. So have you heard of the Derma Roller? It's a handheld device that you roll on your skin and then you infuse your vitamin C after that. So you get certain home care, which is great for somebody who wants to look for something that they can even do at home. The next that we come to are IV infusions. So what are these infusions? When you take an oral tablet, do you know how much of it is absorbed by your body? Maybe 10 to 15%, maybe 20% tops. But when you take an IV drip, so that may be a D, it may be a B12, it may be a vitamin C, it may be calcium, it may be anything, you're actually getting almost 90 to 95% of it literally into your body. So for me, I love a lot of infusions and their whole cocktail of vitamins that we make, and we infuse these. These are all very safe and very effective, and it works brilliantly on pigmentation, on glow, on energy, on immunity, on so many aspects that we have on our skin. The last and my most favorite are Medi-Facials. So what are Medi-Facials? They are facials which are done in a medical way, hence the word Medi-Facial. In these, we combine various technologies. So for pigmentation, the certain things that you can combine in your Medi-Facial could be a microdermabrasion, could be a quick superficial peel. Remember, we spoke about superficial peels. It could be a quick laser. It could be mesotherapy. And you can do this all as a facial. So in conclusion, what I'd like to touch on is don't just think your clinic treatments are the end all and the be all for your skin. Make sure that you use good quality home care and you take care of the sun. So stay tuned and stay glamorous.